Good evening, everyone. Your host, DW, Daniel Whited from Denver. DW, take it away.
Well, welcome to Dr. Becky's Clinic, everybody. We are so glad to have you on the call, and it's still not too late to shoot out a text message to one of your buddies that might be going through some challenges in life, and they can get some answers right here with Dr. Becky's Clinic, where the world is her waiting room. And that's exactly what we're seeing happen. We're seeing lives being touched and changed, and emails being sent and answered, and information being shared that she has been given to quite a few people, and it's just off the charts how busy she's getting, and we just appreciate all that she's doing. Just a little bit of background with Dr. Becky. She's she's the medical director at Sisel International, and understands her products on two different levels. Number one, at science level and a doctor level, and number two, from personal application and using them and getting results from them. And that's what's kind of exciting, is that when she's talking to you about something, it's not that she knows, but she does know. However, she also has experienced it. Board-certified gastroenterologist. And this is something I think is kind of impressive. One of the first females to be accepted and to graduate, in gastroenterologist, becoming a gastroenterologist, also from University of Arizona. Practiced for several years, 13 years, I believe, in Tucson, Arizona, and was introduced to nutrition through the networking industry. And, discovered there's other ways to treat people that has, less chemicals and less toxins and less contaminants and a whole lot less side effects, and has grabbed a hold of that and took herself and some of her team to a very successful number when it comes to on the financial side of things. So she knows how to put together a distribution system by being a seven-figure earner herself, and retired from traditional medicine a little over 10 years ago. Dr. Becky, we're excited about the subject tonight. It's not one that everybody likes to throw out there and talk about, but it's the one that probably the most about, and we're excited to get into what we call SupraDetox with Sisel. So, Dr. Becky, welcome to the call. Are you ready for your first question?
I sure am. Thanks, everybody. This is great because we've got people internationally on the call. The call is growing. This is my forte. I love to educate people, and tonight will be fun because this is what I've done for many, many years, is take care of the intestinal tract, and SupraDetox does a lot. Not just for the intestinal tract, but you're going to learn a little bit more about other areas of detoxification with this product.
Well, I'm excited about this particular call just because of your expertise, and some of the conversations we've had have been, very, very enlightening, and to be able to pass on that information. So, the first question we're going to throw at you is, when you think about it, what made you go into the field of gastroenterology? And it's kind of another question a lot of people just really don't want to bring up, but we're going to bring it up and just take care of it right off the top. When and/or how often should someone have a colonoscopy, or even an upper endoscopy?
It's a really good question, DW, and thanks again for being here, because I know you're at the airport and you always make your schedule work for me, and I totally appreciate that. A lot of people ask me how I got into this field, because it's a very male-dominated field. There's not a lot of women in gastroenterology. It's become, a little bit more female-dominated, but, it's always been very male-dominated. And when I was in training, because I trained in Philadelphia, and, you go through your 4 years of med school, and then I did internship and residency in internal medicine. And during that time, they make you go through rotations, meaning that you're going to try out different subspecialties. So you'll do maybe 4 to 6 weeks in cardiology, and then 4 to 6 weeks in pulmonary, endocrine, infectious disease, pediatrics, surgery, OBGYN, of course, gastroenterology. So you get to sample all these different areas of subspecialized medicine. And the personalities that would gravitate towards certain subspecialties was really unique. There was a certain group of personalities that gravitated toward cardiology and pulmonary and neurology and endocrine and infectious disease. And when I landed in gastroenterology for 6 weeks, it was a blast, because the personalities of all gentlemen that I worked with, they were fun. They didn't take life too seriously. They were very procedure-oriented and very serious about doing colonoscopies and upper endoscopies. But one day I asked them, I said, what is it about you guys? And they said, well, if you're in the realm of butts and guts, you need to have a sense of humor. And so I really kind of got along with that whole, that personality. But the big thing that impacted me is I did a lot of clinics in gastroenterology. And I had one lady that definitely impacted me greatly. She was young. She was 35 when she came into my clinic, and she was almost in tears. And when I interviewed her, took her history, she said to me, I could never talk to anybody about this, especially a male physician. And I said, well, what is going on with you? And she had some significant left-sided abdominal pain, lower abdomen, for quite some time, and she started to see blood in her bowel movements. And it really scared her, but she was afraid to tell anyone, and she was afraid to have a procedure, to have her colon looked at. So I sat with her, and we talked about her symptoms, and I said, you know what, the procedure is very easy. You are sedated. We need to take a look. We need to figure out what's going on, because I don't know yet. I felt her abdomen. I couldn't feel a mass. She did have blood in her stool on rectal exam. When I did her colonoscopy, she had colon cancer in her left colon, but it had not gone through the wall of her colon. And so she became a full cure because surgically they, removed it, which I did recommend, and no chemo, no radiation. But if she'd have waited much longer, it could have been pretty much a death sentence or a very detrimental, road for her. So it really made me realize I could do so much good in this subspecialty by prevention, talking to people, getting to know my patients on a level where they felt comfortable with me, not just with women but with men as well. But obviously I felt that I needed to be in the subspecialty because it was very male-dominated. There was no women in the field when I was looking at being a gastrointestinal specialist. So what I wanted to impart tonight for people on the line is not to be afraid of these types of procedures. A colonoscopy is when you go through clean out. You basically are either going to drink liquids or take pills that allow your colon to flush all of the stool out of there, so you're clean. And then when you come in for the procedure, you're sedated, and the sedation is extremely safe. You're monitored for your heart rate, your blood pressure, your respiration. And then when the colonoscopy is performed, you're sound asleep, you're comfortable. It's very safe because everything is seen on a camera. So this little tube is going to go all the way through your colon, your large intestine. And, when I did the procedure, I had the big TV screens there. I could see everything. And I was screening for colon cancer. I was looking for diverticulosis, diverticulitis, ulcerative colitis, Crohn's disease, polyps, colon cancer, anything that would adversely affect the patient. So if you're healthy and you have good bowel movements and no risk factors, age 50 is when you want to go and see your GI doctor. Go talk to your internist or go straight to your subspecialist. Go see your GI doctor and get the procedure done. Because after age 50, and especially with all the toxicity that we ingest and comes into our bodies, colon cancer is on the rise. And it's very significant in terms of what it's doing for men and women. It's the second leading cause of cancer death right now in the country. And it's so easily preventable, and it's very, very safe. So if you're age 50 and above and you've never had one, get one done. But, if you're younger than 50, you have blood in your bowel movements, or your internist did a rectal exam and found microscopic blood, you have a change in bowel pattern, abdominal pain that's localized, family history, you want to go earlier and go see a subspecialist that's board certified like I am and get it done, because you never know what they can find that they can fix right then and there. So I wanted to impart to the audience, this is my passion, to educate people. And especially in my field, there was so much prevention that I could accomplish by doing these procedures. And when it comes to an upper endoscopy, that's basically the same in terms of sedation. It's taking a smaller little lighted camera with the tube and introducing it over the tongue into the esophagus, down to the stomach and small intestine. And we're looking for esophageal disorders, stomach problems, small intestinal, usually mucosal abnormalities that leads to malabsorption. So if you have chronic reflux, if you have acid coming up into your esophagus on a regular basis, don't ignore that. You need to have your esophagus looked at, because what can happen over time is acid, when it bathes the lower esophagus, it can change the lining of your esophagus, because the lining of your esophagus is different from your stomach. So if acid is bathing the lower esophagus, then all of a sudden the esophageal lining starts to mimic the stomach lining, and that's called dysplasia. That means a cellular abnormality. It's an adaptation of your body, but it can lead to esophageal cancer. So you get this procedure done to analyze for something called Barrett's esophagus, and also if you have trouble swallowing. If you swallow food and it's getting stuck in your esophagus, and a lot of people that have swallowing difficulties, it happens with meat and bread, because they're dry and they're usually bigger pieces. And if it starts to stick, you absolutely need to go see a GI doctor, because I can't tell you how many times I went in the middle of the night because people kept eating and eating and eating when they felt food sticking, and then their entire esophagus was filled with food. So I had to pull the food out or gently push it into the stomach. So what can happen is you can get a narrowing in your lower esophagus from acid reflux or from benign strictures, which can be genetic or just happen. We don't understand why, but they can be gently stretched, easily managed, and keep you from an emergent situation. And with upper endoscopies, just as simple and safe as the lower, the colonoscopy. If you've got abdominal pain, if you're on anti-inflammatories, there could be suspicion of an ulcer, so we'd want to take a look to make sure you don't have ulceration of the stomach, small intestine. Check you for bacteria called Helicobacter pylori. So the reason I wanted to talk about this tonight before we get into SupraDetox is so many of my patients, when they first came to see me, were so scared about these procedures. And before I retired, I practiced for 13 years, I probably did about 18,000 to 20,000 colonoscopies and at least 15,000 upper endoscopies. I never had a complication, not with sedation, not with the scope, not with perforation. Everything went great. So don't be afraid of these procedures. Recognize if your body's talking to you, you may need a procedure just to make the diagnosis. We're not going to give a prognosis. Make the diagnosis, and then we can talk about some really good therapies on what you want to do to, get the body and the intestinal tract back into balance. So I just wanted to lay the groundwork out in that regard. So people, and everyone in the audience tonight, if you want to reach out to me about any specific issues with your GI tract, you can email me and I will get back to you, or we can have a conversation, because this is my passion. I've been retired for 10 years, but GI was my world for 13, and I continue on with everything I'm sharing with you tonight. So back to you, DW.
That's awesome. Real quick before we go into the next question. So how important then is absolutely, we've heard a lot since I was a little kid about chewing and chewing your food. When you just said that, I went, man, should we,
Absolutely.
is that? Yeah, go ahead.
Really
is that a big
important. Deal? Well, it's chewing your food really well, because obviously bigger pieces have a chance to get stuck, even in a normal esophagus. If you have a narrowing, then obviously anything can get stuck. But I've actually been in people's esophagus when they had a big piece of steak, or a big piece of bread just hung up in there, and there was no narrowing, there was no disease. It's just they took too big of a bite. Plus, they weren't drinking water or some type of liquid when they were eating. And some people will do this if they're in a rush, and they just, they're stuffing in the food, they're not drinking liquids, and it will get stuck. So you chew your foods well, you drink a lot of water when you eat. Take your time, because sometimes it will get stuck, and it is a life-threatening emergency. What happens is people, when they have a food impaction, they can't take their saliva down. So you can't even take saliva. So they start to expectorate or spit their saliva. That's when they're fully impacted. There's no room in there for anything to get down. So I have to sedate that patient, go gently down with the scope, and gently maneuver to either push the food through without hurting their esophagus, or sometimes we pull the food back out, which is a risk to an area, the trachea, because you don't want to drop any food in the lungs. Because remember, the esophagus and lungs are completely different. You just need to be really careful. So thank you for bringing that up, because that's one big educational issue.
Well, I just love it. I just, some of this stuff is kind of common sense that we know common sense really isn't that common anymore. But with that said, let's jump into our second question. And we talk about the immune system a little bit, but what does it mean that most of our immune system sits in our gut?
This is a good question. And a lot of our products at Sisel support the immune system. And if you talk to certain experts, they're going to tell you 70 to 80% of our immune system actually sits within our gut, mainly the small intestine. And it's so true because we are what we eat. And so if we're ingesting toxins, and especially if we're ingesting bacteria, viruses, funguses, protozoa, the first line of defense is our intestine. And we have lymph nodes and lymph tissue that line the small intestine. So after food leaves the stomach, it's broken down initially with amylase from the mouth, food is, and then there's acid that takes place in the stomach, and then food and bacteria and whatever toxins go into the small intestine. That's where all the lymph tissue sits. And there's something called gut-associated lymphoid tissue. Some of you may have heard of the term GALT, G-A-L-T. It's 3 layers of defense with linings of lymph nodes and lymph tissue that will go after bacteria and viruses and protozoa and fungus. And there's this, it's very coordinated in terms of when a certain toxin will come in, and our gut will be there to fight it off. We also create proteins from this lymph tissue, something called immunoglobulins, IgA to be specific. But these immunoglobulins, these proteins, are going to help to get the lymphoid tissue on fire to fight off any kind of toxicity that's coming in. The other line of defense, which is basically the number one line of defense, is good bacteria in the gut. I talk about this all the time. We've got good bacteria, we have bad bacteria in the intestinal tract. The good bacteria is there to be somewhat of a guard to activate all these lymph nodes and lymphoid tissue in the gut. So let's say, I'll give the analogy, you walk into a club, let's say you go to a dance club, and there's a big bouncer standing there at the front door. That's your good bacteria. He is the bouncer. And if he can't handle things initially, or even if he sees you coming, he's going to activate the people behind him, more bouncers, bigger people to take care of the situation. That's exactly what happens in your gut. So here comes the bacteria, here comes the toxicity, the viruses, the fungus, and the good bacteria is like, okay, we're going to start the process, but we're going to send a signal to the lymph tissue that lines the intestine so more lymphocytes come out, B cells, T cells, IgA immunoglobulins to fight everything that's happening in the luminal, in the area of the intestine. And the reason this is so important is if we have a breakdown of that system, if we have bad bacteria or a breakdown in our immune system, if we're not strong nutritionally, we're overwhelmed with toxicity, then those toxins can come right through the lining of the intestine. And remember, the intestine is very vascular. So if you have all these toxins and these microbials coming in, they come into the vascular circulation, and then they just wreak havoc. So you've got free radicals now running around. You have DNA damage. You have a breakdown in cell-to-cell communication. Enzymatic functions aren't working well. Vital organs start to malfunction. Then you're set up for degenerative issues, inflammatory issues, potentially liver disease, and then the toxicity becomes overwhelming. So when I talk a little bit about the nutrients with SupraDetox tonight, not only are we going to fortify the area of the intestine and help to cleanse out some toxins, we're also going to fortify areas that are responsible for removing toxins through the kidneys, the endocrine system, our sweat glands, our liver, our respiratory system. There's a lot going on in our bodies. And what I love about this particular product, when Tom Sr. put these nutrients together, he recognized it wasn't just about the intestinal tract. I mean, obviously it's very, very important, but there's other areas in our body that need to be fueled to create that balance of cleanliness within our system. So back to you, DW.
Well, I love that. I love when we get into balance, and of course, I mean, that's maybe another product we'll jump into later, Balance D. But I work quite a bit with doctors, and I handed a couple of them our Supra product that we have, SupraDetox, and he goes, well, I'm just, real picky about this, that, and the other, and I'm just, kind of got a little defensive. And Dr. Becky, when they started reading through the ingredients and what was in it, they go, wow, man, that's really good. And their answer was, to me, was, this is a superior product. And so that brings us to the third question, why is it important to cleanse the intestinal tract from time to time? Okay. And then maybe you'll touch on some of the key ingredients in the SupraDetox which is a natural detox formula aimed, at the intestinal tract.
Absolutely. It's, in my opinion, again, you're going to have some experts in even the realm of gastrointestinal specialties that say you don't have to do colon cleanse. It's not necessary. Our body knows how to detox itself. What I saw in my medical practice was pretty shocking in terms of the degree of constipation, the sluggishness of the intestinal tract, the sluggishness of the body in general, especially when the intestinal tract slows down. Everything slows down because you become this toxic soup bowl because you're not eliminating waste. And I had patients, whether it was due to diabetes, which will affect the motility of the gut, or they were on certain drugs that affected the motility, namely narcotics or other certain, anti-inflammatories out there that could cause constipation. But if you start to back up, it's like a sewer backing up in your system. And I had patients that would move their bowels every couple of days, not too horrible, but once a week, every 2 weeks, every 3 weeks, and my worst case was a lady that only moved her bowels about once a month. And that's just no lie. And what you're looking at is somebody that's so toxic and they need some help. And so we need to, number one, give them a good cleanse opportunity to get all that toxicity out of there, but then get them onto a routine. And so SupraDetox actually represents something that you can do once a quarter. This is not something you're going to do every single day, months and months and months on end. Absolutely not, and I'll tell you why in a second. But when you pick quarterly or even every 6 months, it's just enough to kind of rev up the system, and then you get back into your routine to create good movement of the intestinal tract. So you're eliminating on a regular basis. If you go back in time and you look when we were eating more raw foods and whole foods, we didn't have the processed foods, we were taking in more fiber, we were better hydrated. Every time you had a meal back in those days, you went to the bathroom. It's called the gastric colic reflex. Gastric meaning stomach, colic meaning colon, and then reflex is that the two communicate. So you eat, food goes into the stomach, digestion starts to happen, and then you have something called peristalsis, movement, that allows your colon to go, hey, I need to evacuate. And so if you're eating 3 times a day or 5 times a day, you would actually move your bowels 3 to 5 times a day with a good bowel movement because you're eating a lot of fiber. In today's world, some people are so excited to say, I have a bowel movement once a day or every couple of days. No, you need to have better bowel movements because it's just toxic soup. So with the SupraDetox, in terms of the mild laxative effect to really help eliminate the colonic waste, the number one ingredient is something called Cascara sagrada. I'm very familiar with this ingredient. Again, this is an herbal laxative to be used once in a while. You can use the capsules of SupraDetox once to twice daily for up to 7 days. You're probably not going to need it that long, but it's going to allow for contraction of the intestinal tract. It's going to allow for movement of the bowels, to allow that waste to be eliminated. Plus, it decreases the reabsorption of water in the colon, meaning there's more water, more hydration in the large intestine. So with contraction and hydration, and if you have bulk, which means fiber, in the intestines, you're going to evacuate. And because it's about motility, you only need it initially to stimulate the motility a little bit aggressively, and then I'm going to talk to you a little bit later on how you maintain that motility without the cascara. So cascara is one of the main ingredients, and it's a great herbal laxative. But again, you just use it to potentiate, elimination, and especially if you want to rev up your system for weight release. So when I do my webinar on Thursday, I'm going to talk to you about SupraDetox for people that really need to allow the elimination and detox to happen a little bit faster, more efficiently, which will potentiate your positive results in terms of weight release with our products. So with cascara, the other nutrients, and I'm just, I'm going to take a look at my list because it's very extensive. Aloe vera is part of SupraDetox, and when I was in practice, I used aloe a lot, especially with my patients that had irritable bowel. And I'll get into all the definition of irritable bowel in a little bit, but aloe is very, very soothing. And then there's yellow dock root powder, which is a blood purifier. So anytime I mention a nutrient, it's an extract, it's a root, it's a powder, and I say it's a blood purifier, what it does is it increases your circulation. And what it does is it fuels circulation through your detox organs, like your liver, like your pulmonary system and your kidneys and your skin. So with the yellow dock, you're allowing for more of that blood purification to happen because of increased circulation. I love the fact that Tom put in ginger and garlic powder, because ginger's been used forever to help digestion. It increases circulation, so better absorption in the system and better elimination. And garlic has been used for centuries as an antiseptic, which means it's a natural antibacterial, antifungal, antiviral. Marshmallow powder, very interesting about marshmallow powder, because not a lot of products contain this. But if you look at the research on marshmallow, it's pretty extensive for helping digestion and absorption, but very good for alleviating constipation. It's through a little bit of a different mechanism than the cascara. It's allowing for a little bit more of like water to come into the colon instead of water being non-reabsorbed back into the system. So it's potentiating the effects of the cascara, and also something called the buckthorn powder, which is on the same level as the cascara, just a little bit different in terms of where they get the nutrients. Oregano is a phenomenal product for the lungs. So oregano powder will help with decongestion. A lot of people that are detoxing, they may notice a dry cough, or maybe it's a wet cough, maybe they've been a smoker, around pollution, toxins in the environment. This is a decongestant. So it opens up your lungs, so you breathe easier and you push the toxins out of your lungs faster. Burdock powder is one of my favorite nutrients of all time. It's a detoxifier on so many levels, but it's an adaptogen. You've heard me talk about adaptogens. They help the body adapt to stress, physical stress, emotional stress. But this particular burdock also increases bile release from the liver and the gallbladder, if you still have one. Either way, you're still going to produce bile, and you dump it into the intestines, which is a cleanser. But burdock actually acts as a prebiotic. So it's a fuel to increase your body's ability to produce more and more probiotics. Remember the good bacteria, that first line of defense. There's dandelion powder, slippery elm, and if you remember S for slippery, remember S for soothing, because it's very, very soothing to the intestinal tract like aloe vera is. So it's been used for a very long time with people who have irritable bowel, inflammatory bowel, diverticular disease, and it's very good for digestion and absorption. Red clover is an interesting nutrient. It's from the legume family. That's the bean family, another blood purifier. But great studies on red clover in terms of how it helps the cardiovascular system and may decrease the plaque that sits in our arteries. And then the last nutrient, which is always one of my favorites, is milk thistle. And milk thistle is great for the liver. So if you have hepatotoxicity, toxins sitting in the liver, fatty liver, alcohol-related liver disease, drug-related liver disease, hepatitis B, hepatitis C, milk thistle is perfect to round out all these nutrients. So SupraDetox is about good colonic movement and elimination, aiding digestion and absorption, helping your kidneys work as a better diuretic, helping the respiratory system expel a lot of these toxins, and a lot of these nutrients will also increase the body's ability to sweat better, especially the ginger. So it's a multifactorial approach to detox. When I first looked at this product and I saw cascara, I'm like, well, I've used cascara for years in my practice, but I didn't like it that much because it was just a single product. So all it did was just move the colon, and there's so many other areas to address. This is a very comprehensive, superior product, very nutrient dense, and again, because the extracts are they're pure and they're dense, that you're going to get maximum effect. You only use it for a couple of days that you need it. If you need it for the full week, that's okay, but then just think about it quarterly or even every 6 months. So back to you, DW.
Well, that's a lot of information. I was interested in that. It just even. Oh yeah, but you're talking about how it helps with the heart and everything, and I'm like, when I talk about the product, and just on a layman's term, my simple terms are real simple. If the eliminator is not eliminating, you're in some serious trouble, and if you're not, you soon will be. And we have a way to help the eliminator to eliminate, to get the whole thing working. But it's going to go somewhere. If it's not going to go out, it's going to go up into your system, and it does damage the heart, and it does damage, does so much damage, and I'm just excited about it. Now, we get a lot of questions, a lot of us that are, trying to help people move forward, and one of the questions we get, is people that are going through irritable bowel and having those kind of challenges. And a lot of people have slammed an enormous amount of caffeine through, like soda pops and Dr. Peppers, especially, and Mountain Dews and so on, and even the some of the drinks that are out there. But what is an irritable bowel? And what can people do on a regular basis to help maintain optimal intestinal functioning? In other words, the eliminator eliminating.
Exactly. Irritable bowel is so common. It was about 80 to 85% of my practice. It's a constellation of symptoms secondary to a motility disorder of your intestines, meaning that, again, when you eat food, you chew it, it goes down the esophagus, there's contraction of the esophagus, then it goes into the stomach, there's acid release, there is contraction of the stomach, then it goes into the small intestine, there's contraction, motility of the small intestine, then the waste goes into the colon, then it's eliminated. So you have to have this functional peristalsis, this functional motility throughout your intestinal tract. If it gets screwed up because you're toxic, nutritionally depleted, you're eating foods that are hard to digest, things that are chemically altered, genetically modified, antibiotics, steroids, hormones, pesticides, insecticides. So if you start putting stuff into your system that makes those contractions irregular, what do you think happens? Well, you start to bloat. The distension is very evident. Some people would come into my office completely distended by the end of the day, and in the morning they had a flat abdomen. Then they come into my office and they look like they were 9 months pregnant, men and women. So it would distend them, and so all this gas would build up, and then the bad bacteria would build up. But there's a lot of pain involved. There's a lot of people with irritability of the bowel. There's a lot of, the gas passage, sometimes burping on top of it, and then change in bowel patterns. So diarrhea one day, constipation the next. So the irritable bowel is very frustrating for a lot of people. In order to maintain good peristalsis, means good movement and good bacteria, I recommend that after you do the SupraDetox is you get on to our Sisel shake. You've got great protein that's going to support your immune system. Going back to the second question, support the immune system, 75 to 80% sits in your gut. There's fiber in there, but if you need additional fiber, because most people do, we need 25 to 30 grams of fiber a day. Most people take in half. Then add something like flax. I love ground flaxseed because it's got soluble and insoluble fiber. Very balancing. If you tend to be constipated, it's going to make you move more regularly. If you tend to have diarrhea, it absorbs the extra liquid and makes you go more regularly. So extra flaxseed, getting that extra fiber from your diet, that's very common. We talk about it, but if you're eating processed foods and fast foods and all this other garbage out there, you're not putting fiber into your system. So go with the fruits, go with the vegetables, go with wheat and things that are good to bulk and give you that soluble and insoluble fiber. If you need to supplement with flaxseed, that's great. Psyllium's another good option for a lot of people. I found in my patient base that psyllium was very gassy. So if that's the case, then go with the flaxseed. You can grind it. You can add it to your sizzling shake. That's what I do every morning. You want to stay hydrated. If you're dehydrated, it's just going to mess up your gut. You need hydration throughout the day to allow your gut to contract normally, to absorb normally, to eliminate. One of the biggest things with constipation was dehydration. If you're drinking sodas, you're taking in way too much bad coffee, not our good coffee because we've got good coffee at Sisel. If you're taking in the stuff that's got acrylamide and toxicity with it, it just dehydrates you even more. And if you tend to run constipated on a basis despite the fiber, the hydration, exercise obviously gets the motility going in the intestines, then you may need some magnesium. So I would look at, looking at all the trace minerals, something like the Spectrum Max, to give you good mineral base to allow for better contraction of the intestine. Once you do things like that, the irritable bowel goes away and quality of life improves. And I've had people literally doubled over in my exam room crying from pain that I wasn't sure if they were dying, but it just ended up to be irritable bowel. Not inflammatory bowel, that's ulcerative colitis and Crohn's. This is a little bit different. But if you just follow those simple things, and then prebiotics and probiotics are really important. And I'll definitely do a call on Balance D because it's great for, obviously, D supplementation because a lot of people are vitamin D deficient. That leads to a whole host of issues. And then there's prebiotics, which fuel the body and the intestinal tract to make more probiotics, and that's the good bacteria. So you're supporting your luminal defenses, supporting that immune system, and allowing for your body to adjust, and then you digest, and you eliminate, and you feel good. And trust me, your energy level goes off the charts when your gut is working.
I'm excited. I mean, it's just everybody here. I mean, you know, your audience just wants to give you double hugs all the time for the information you give us and then throw at us. I am going to sneak another question in, even though we're going into overtime just a little bit. And when it comes to sports, people love overtime. However, they definitely love it when it comes to Dr. Becky's clinic because they feel like they're getting that little extra bit to help them get through. When it comes to the diatomic water, and I know you know I'm going to ask something about the water, and I know we talk about it a lot, but when it comes to our brand new system that's about ready to be launched and shipped, the diatomic water, you know, what is that water going to do for the intestines?
It does a lot. It's going to increase nutrient absorption, you know, right through the wall of the intestine. And remember, hydrogen, it's a very small atom, so it's very penetrating, and it draws good things with it. So nutrient absorption is going to be maximized at the level of the intestine and at the level of the cells. And so it's going to potentiate better digestion and absorption. It hydrates really well. What do we talk about? To have good bowel movements, you need really good hydration. And then also, it's potentiating the good bacteria over the bad bacteria. And if you know much about the way we produce gas within the intestinal tract, good bacteria is always about hydrogen. So it's giving that positive cascade of effects to support digestion, contractility of the intestinal tract, elimination. And, you know, we don't have a testimonial tonight because a lot of people are really shy about, well, I don't know if I want to give a testimonial about SupraDetox. I get that. But I will tell you, you know, I'm a GI doctor, so I'm not shy. When we hooked up the diatomic hydrogen water system at Sisel's office, I was one of the first people down there with my glass to try it. I'm very excited. I knew the technology. I'd learned so much from Tom Sr., and I couldn't wait to really, you know, just give it a try. Number one, it tastes amazing because I'd been drinking out of the fountain for like a couple of weeks. So I tried this, and I'm like, this tastes incredible. Energy, definitely. Felt that because it crosses the blood-brain barrier. Then, you know what, the best bowel movement ever. You know, it was amazing that it just allowed for such an incredible contractility of the intestinal tract to alleviate waste. And I'm not the only one that this happened to. It's just funny because I had to do a little poll in the office with some people, and I'm like, okay, how'd you feel? They're like, I just had the best bowel movement ever. I said, see? So it's a natural detoxifier. You know, it allows for natural production of glutathione and superoxide dismutase and catalase and contractility of the bowels, and allows to scavenge free radicals and hydrate and increase absorption and elimination. So, I mean, you know, hopefully I didn't shock too many people, but wow, I felt great, and I continue to drink that water every single day when I'm in the office because it's amazing. So always know I'll finish with the water because it potentiates every nutrient that we take in through Sisel product, and it's allowing us to get into that true synergistic balance with our body. So thank you, DW. Appreciate you so much. I know you have to jump on a flight. And thanks to everyone that stayed on the call. I appreciate every single one of you. And if you need to reach out to me, you know, the email is bmaes@siselinternational.com, or call customer service. They will forward your emails to me, and I'll be glad to answer them. Thanks, everybody.
You're absolutely awesome, Dr. Becky. We love the call. They just get, you know, it's bad grammar, but they just get better and better and better. And, you know, fantastic. So everybody, we just thank you for being part of Dr. Becky's clinic, where the world is her waiting room, and you get help by one of the best of the best. And so just same place, same time next week. Bring a friend. We'll be getting into another amazing product. Do not forget to plug into you know, the weight loss webinar that she's doing on Thursday evening. That information will be available to you as well, and all the other Sisel calls that we have going on with the Wake Up and the Connect calls and everything. Thank you for being part of this call tonight, and have a good evening.
Thanks, everybody. Bye.